Diagnosing an abdominal aortic aneurysm. An abdominal aortic aneurysm (AAA) usually causes no symptoms. Therefore, they tend to be diagnosed as a result of screening, or during a routine physical examination when a GP notices a distinctive pulsating sensation in your abdomen. A diagnosis can be confirmed using an ultrasound scan. Ultrasound can also determine the size of the aneurysm, which is an important factor in deciding on a course of treatment. Screening. All men in the UK who are 65 or over are offered an ultrasound scan to check for AAAs. All men should receive an invitation in the year they turn 65 years old. Men who are older than 65 can refer themselves for screening by contacting their local NHS AAA screening service. Treating an abdominal aortic aneurysm. Treatment for an abdominal aortic aneurysm (AAA) depends on several factors, including the aneurysm size, your age and general health. In general, if you have a large aneurysm, 5.5 cm or larger, you will be advised to have surgery, either to strengthen the swollen section of the aorta or to replace it with a piece of synthetic tubing. This is because the risk of the aneurysm rupturing is usually greater than the risk of having it repaired. If you have a small 3.0 to 4.4 cm or medium 4.5 to 5.4 cm aneurysm, you will be offered regular scans to check its size. You will also be given advice on how to slow its growth and reduce the risk of it rupturing, for example, stopping smoking, and perhaps medications to reduce your blood pressure and cholesterol level. If you have a large AAA. If you are diagnosed with an AAA that is 5.5 cm or larger, you will be referred to a vascular surgeon, a surgeon who specializes in diseases of the blood vessels, who may recommend an operation. The surgeon will discuss treatment options with you, taking into account your general health and fitness, as well as the size of your aneurysm. If it's decided that surgery isn't suitable for you, it's still possible to reduce the risk of the aneurysm bursting, and you will have regular scans to check its size, in the same way people with small or medium aneurysms are treated. See below for more information on treating small and medium aneurysms. There are two surgical techniques used to treat a large aneurysm. Endovascular surgery. Open surgery. Although both techniques are equally effective at reducing the risk of the aneurysm bursting, each has its own advantages and disadvantages. The surgeon will discuss with you which is most suitable. Endovascular surgery. Endovascular surgery is a type of keyhole surgery where the surgeon makes small cuts in your groin. A small piece of tubing called a graft made of metal mesh lined with fabric, is then guided up through the leg artery, into the swollen section of aorta, and sealed to the wall of the aorta at both ends. This reinforces the aorta, reducing the risk of it bursting. This is the safest of the two types of surgery available. Around 98 to 99% of patients make a full recovery, and recovery time from the operation is shorter than if you have open surgery. There are also fewer major complications, such as wound infection or deep vein thrombosis (DVT). However, the way the graft is attached is not as secure as open surgery. You'll need regular scans to make sure the graft hasn't slipped, and in some patients, the seal at each end of the graft starts to leak and will need to be resealed. You will need to have surgery again if either of these occurs. Open surgery. In open surgery, the surgeon cuts into your stomach, abdomen, to reach the abdominal aorta and replaces the enlarged section with a graft. This type of graft is a tube made of a synthetic material. Because the graft is sutured into place by the surgeon, it's more likely to stay in place, and will usually work well for the rest of your life. The risk of complications linked to the graft after surgery is lower than in people who have endovascular surgery. Open surgery isn't usually recommended for people who are in poor health as it is a major operation. It is slightly more risky than endovascular surgery, with 93 to 97% of patients making a full recovery. The main risk of open surgery is death or heart attack, and recovery time is longer than with endovascular surgery. There is also a greater risk of complications, such as wound infection, chest infection and DVT. If you have a small or medium AAA. If you are diagnosed with a small 3.0 to 4.4 cm or medium 4.5 to 5.4 cm aneurysm, you won't be referred to see a vascular surgeon, as it's unlikely you'd benefit from surgery. You'll be invited back for regular scans to check the size of the aneurysm, in case it gets bigger, every year if you have a small aneurysm and every 3 months if you have a medium aneurysm. You will also be given advice on how to prevent the aneurysm from getting bigger, including stopping smoking, eating a balanced diet, ensuring you maintain a healthy weight, taking regular exercise. If you smoke, the most important change you can make is to quit. Aneurysms have been shown to grow faster in smokers than in non-smokers. Read more about stopping smoking and nicotine replacement therapies (NRTs) that can make it easier to stop smoking. Your GP will be sent your test result and may decide to change your current medication or start you on a new one, especially if you have high blood pressure, which you will probably be treated for with a medication called an angiotensin-converting enzyme ACE inhibitor. High cholesterol, which you will probably be treated for with a medication called a statin. Treating a ruptured AAA. Emergency treatment for a ruptured AAA is based on the same principle as preventative treatment. Grafts are used to repair the ruptured aneurysm. The decision on whether to perform open or endovascular surgery is made on a case-by-case basis by the surgeon carrying out the operation. Preventing an abdominal aortic aneurysm. The best way to prevent getting an aneurysm, or reduce the risk of an aneurysm growing bigger and possibly rupturing, is to avoid anything that could damage your blood vessels. This includes smoking, eating a high-fat diet, not exercising regularly, being overweight or obese. If your GP finds out you have high blood pressure or a high cholesterol level, you may be prescribed medication for both. This will reduce the risk of developing an abdominal aortic aneurysm (AAA). Smoking. Smoking is a major risk factor for aneurysms because it causes atherosclerosis, hardening of the arteries, and raises your blood pressure. Tobacco smoke contains substances that can damage the walls of the arteries. It is known that smokers are 7 times more likely than non-smokers to develop an AAA. The more you smoke, the greater your risk. People who regularly smoke more than 20 cigarettes a day may have more than 10 times the risk of non-smokers. If you want to stop smoking, your GP will be able to refer you to an NHS Stop Smoking service, which will give you dedicated help and advice about the best ways to quit. You can also call or chat online with Quit Your Way Scotland. The specially trained helpline staff can offer you free expert advice and encouragement. Diet. Eating a high-fat diet increases your risk of atherosclerosis. It's especially important to limit the amount of foods you eat that are high in saturated fat, such as biscuits, cakes, butter, sausages and bacon. This is because eating too much saturated fat can lead to high cholesterol, which can build up in the artery walls. Exercise. Being active and doing regular exercise lowers blood pressure by keeping your heart and blood vessels in good condition. Regular exercise can also help you lose weight, which will also help lower your blood pressure. Adults should do at least 150 minutes, 2 hours and 30 minutes, of moderate intensity aerobic activity every week. Examples of moderate intensity activity include cycling or fast walking. For it to count, the activity should make you feel warm and slightly out of breath. Someone who is overweight may only have to walk up a slope to get this feeling. Physical activity can include anything from sport to walking and gardening. Weight. Being overweight forces your heart to work harder to pump blood around your body. This can raise your blood pressure, which in turn puts pressure on your arteries. Use a BMI healthy weight calculator to find out if you need to lose weight. If you need to shed some weight, it's worth remembering that losing just a few pounds will make a big difference to your blood pressure and overall health.